and welcome. You're watching NDTV. I'm Rishika Barwa. India's COVID-19 cases are rising once again. We've reported the highest COVID cases in the last 5 weeks. But the good news is that our pace of vaccinating against the virus has also picked up. Now, with more than 1 million vaccinations for 2 straight days, is the vaccine really our best shot at preventing a second wave? Joining us on the broadcast, Dr. Randeep Guleria, to answer all your questions on the coronavirus. Thanks, Dr. Guleria, for sparing your time and being with us. It's worrying to see India's cases spike again. What, according to you, is the reason? Would you say that variant strains are to blame?
I think there are multiple factors. Some of them are related to our own behavior, because many people feel that COVID is over and COVID appropriate behavior actually is not being followed. We are having large parties and there are huge crowds that one can see, and masks are not being worn, there is no physical distancing, and any of these events has the potential of becoming a super spreading event. We must continue to remember that COVID has not gone away, the virus is still around, and therefore it's looking for opportunities to spread. We still have a susceptible population. 75% of our population still is susceptible to COVID infection. They don't have antibodies. And therefore, any event which gets all these people together can lead to a spurt in the number of infections. It's also possible, and we know this is going to happen, that there would be emergence of variants which will be a little more infectious, and that could also be another reason for the increasing number of cases.
Right. We're told now, as per studies, that the strain that's prevalent in Brazil, for instance, is more dangerous. Is India doing enough to identify and therefore contain COVID variants here in India? Is there an Indian strain, for instance, that we know about, which is dangerous, or do we have any information like that?
So in India now there is a large network of more than 10 centers which are looking which do genome sequencing and look for any variants, and they are not only looking for the 3 variants which we know of, the Brazil, the South African and the UK variants, but for any new variants which may be emerging in India. This is an ongoing process, and 2 things are being done. 5% of random samples which we are coming positive are being looked at for any variants. Along with that, any area where there's a cluster or a surge in the number of cases, samples are also being taken for that to look for variants. We must understand that we will continue to have variants over a period of time. The virus will continue to mutate, and with the mutation, new variants will develop. Our concern is basically 3. One is this variant of clinical significance in a way that is it more infectious? Is it going to cause more disease? Secondly, is it more virulent? Is it going to be more fatal, cause more hospitalization, more death? And thirdly, will it have developed an immune escape mechanism that will escape our vaccine efficacy? All of this is being looked at. There is some concern, like I mentioned, of the variant causing more cases, but it's not really, the data doesn't suggest that there's any chance of, as of now, of more severe infection or the vaccine not working.
Okay. Focusing specifically on Maharashtra and Punjab, these are 2 states that are seeing a worrying surge in COVID-19 cases among the 6 worst hit states in the country at the moment. Should India brace for a second wave? What's your assessment?
I think we should start it's always better to be ready rather than regret later on. So I think we should have a plan in place, and we should really go back to our basics like we did in the beginning of having good amount of testing, and then testing, tracking, isolation, having a policy for containment areas so that the areas where we are seeing a surge in the number of cases, that doesn't spill over to other areas. In most parts of the country, the situation is very good, and we need to make sure that we don't allow the increasing number of cases to happen in that area.
Right.
So strategies which we had done in the beginning of the pandemic need to be re-looked at, and we really need to develop a strategy of how do we really get people to follow COVID appropriate behavior again.
Okay, I know you say that India should always be prepared for, a surge in cases or a second wave, but do you think, Dr. Guleria, at this moment we are heading there, if you look at the numbers?
So we are seeing a rise in the number of cases. The challenge is, can we keep it down to a bare minimum and we have just a small surge rather than a big surge? And I think that's where aggressive vaccination will also help us, because if we're able to vaccinate more and more people, we are able to prevent or get some large number of people having some degree of immunity and thereby also preventing the transmission of disease.
Right. That brings me to my next question. More than 1 million vaccines have been given now for 2 straight days. Can the pace of India's vaccination currently, where it stands, will it be effective in combating this surge in cases?
It will to some extent, and there is data which has emerged from even from the UK and from other countries that vaccinating a large number of the population will help in decreasing the number of cases. One of the reasons for the decline in the number of cases in UK has been linked to the aggressive vaccination policy that they had. We have different challenges. Our population is very large, and therefore we really need to look at strategies of how can we further ramp up the number of people being vaccinated per day, and to make sure that it's equitable, it covers both the urban and the rural area, and no one gets left behind, because we really need to develop a strategy of vaccinating all those who need to be vaccinated as early as possible.
Right, but in your assessment, is 1 million vaccinations a day enough? Does India need to do more? Do we need to increase the pace?
So we would need to increase the pace as much as we can. We have two sort of rate limiting factors. One is we should have enough doses which we can give to everyone and we can distribute nationally. And these doses should be there, keeping in mind that we have to give 2 doses. So we shouldn't really run out of the second dose. So that supply chain has to be maintained.
Right.
And secondly, we need to develop strategies where we can get more and more people to come forward to get themselves vaccinated and have more and more vaccination centers. And so we need to expand this, maybe even go out from currently what we're doing, that is healthcare centers, to other centers where vaccination can be done, like a mass drive or a mass camp, where you can have huge vaccination centers being opened up.
Right. You raise a whole host of very important points here, and of course supply of vaccine being extremely key to accelerating the pace of vaccination. Bharat Biotech interim data has shown, Dr. Guleria, an 81% efficacy. The big question now is, this is interim data. By when can we expect final results? Because it will also go a long way in inspiring confidence in the vaccine.
Correct. The interim data is very encouraging because it shows that the vaccine is effective. It is efficacious. We already knew that it was safe. But like you said, we need to have more data because this is just the interim data. A lot depends on the number of cases that they get who get COVID infection in the phase 3 trial. They have to really get about 130 people who get COVID infection. They have 40 odd right now. They will do another interim analysis when it crosses 80, but they will need to have 140 people who get COVID infection. Then they will actually be able to break the code and see how many of them were in the vaccine arm, how many were in the placebo arm, and was this different? What was the actual efficacy, which would be statistically significant?
All right, that's interesting. But I mean, look at Canada, for instance. Canada has now 4 vaccines, and the single dose Johnson & Johnson being the latest vaccine that Canada has approved. Is the single dose Johnson & Johnson, for instance, a viable vaccine candidate as far as India is concerned?
Yes, it is. I think we have to look at all the vaccines that we get, and we are, I think already Dr. Zeddy's laboratory has filed in for the Sputnik vaccine, and we're looking forward even for the Cadella vaccine. But we should look at all the vaccine candidates that we can get. They have to get the necessary regulatory approvals so that they are approved for use in India. But once that is there, the more vaccine candidates that we can get for our country, the larger the vaccine pool that we'll have, and more the number of people that we can vaccinate.
But when we talk about vaccinating more number of people as quickly as possible to prevent, say, a second wave of infections, if you look at what's happened in Germany and France, they've endorsed the UK dosing interval, which is 12 weeks apart. Should India therefore reconsider a more liberal dosing regimen with an increased gap between the 2 doses?
So there is data now emerging, and there has been now analysis done from the studies done in Brazil, South Africa and in the UK, published more recently, which does suggest that if you were to delay your dosing, the immune response is good. And modeling data also does suggest that it may give a better efficacy. We need to look at the data critically and then see whether it is sufficient or whether one needs more data. At the same time, also look at logistics. Is it possible to do that?
Yes.
But I think it's something that can be explored. remember we are giving two vaccines, so we need to really look at it from how do we do it for both the vaccines, or do we do it only for one vaccine candidate, and logistically how will it pan out in terms of giving the second dose. But it's something that can also be looked at.
All right. One of the other questions that's been asked by a lot of our viewers is whether children should be allowed to go back to schools where cases are rising. Now, schools have opened in several parts. There have also been reports of clusters of infections emerging from certain schools and hostel areas. What would you recommend?
So this is always going to be challenging, because we know that children, when they go to school, they cannot have COVID appropriate behavior. They will tend to crowd together in classes or when they have a break. And children, although they have a mild infection, they can carry the infection to their house and give it to the elderly, to their parents, and that can lead to an increase in the number of cases. So one would have to look at it very, very critically. It's a big challenge because schools have been closed for 1 year, but I think if the cases are rising in a particular area, in that area one has to be very, very cautious about opening schools. It would be a big challenge because like you rightly said, there are areas where there has been a cluster which has been linked to schools being opening up in that area.
Right. Well, there's no easy answer to that question, is there? Dr. Guleria, we've had a whole host of questions that have been coming in about the vaccination per se. I'm going to pose some of them to you. What are the most common side effects of the COVID-19 vaccine?
Luckily, the side effects of the COVID-19 vaccines are very mild. But what we have seen now is that some patients will complain of pain at the vaccination site or having fever for a day or two after taking the vaccine, along with body aches. A few patients have a little bit of gastritis and stomach upset or headache, but all of them usually tend to recover within 24 to 48 hours. Usually we advise them just to take symptomatic treatment like paracetamol or something for the nausea and vomiting. They become all right in a day or two.
All right. And what are some of the more severe side effects of vaccines that one should be careful about?
So the severe side effects that we are really worried about is what is the anaphylaxis or the allergic reaction which may happen in some individuals. And that is why everyone should stay at the vaccination site for at least half an hour, because that is the time that this reaction can occur. And in all sites, there is a facility to take care of this. Very rarely we've seen this, but patients do develop a little bit of an allergic reaction which requires an injection of an anti-allergic or steroids at time. This is the rare reaction which can happen with all vaccines. It does happen with COVID-19 vaccine, but it's not something that is a cause of great concern.
Right. What about vaccine-related deaths? We know that, those are all subject to investigation. The government so far says there have been no fatalities as a result of the vaccine. But it is a question, it is an inhibition that a lot of our viewers have expressed.
Yes, I can understand that. But one must understand that if we were to look at a large population, some people will die of other causes which may not be related to the vaccine. So it's very important to establish a cause and effect relationship, because if it's not related to the vaccine and it's happening just as by chance, then it's something which is one should not be concerned about. But having said that, because of the fact that vaccines are new and we're giving that, every death which occurs within a few days of vaccination should be really evaluated, because we have to be very sure that we are not missing out on any rare side effects which may happen because of vaccination, which was not picked up in the trials.
Well, I think that's a very important clarification. Dr. Guleria, a whole host of more questions lined up. We're going to slip into a very short break. On the other side, Dr. Guleria will answer your questions on the COVID vaccine. Stay with us. Welcome back. One of the most commonly asked questions, Doctor, has been about cancer patients who are undergoing chemotherapy. Is the vaccine safe for them? Should they get the jab?
Yes, if you look at the priority list or the people who need to get the vaccine, even if they are between the age of 45 to 59, cancer is one of them, and that is because they have a higher chance of getting severe infection. So if you have a cancer and you're on chemotherapy, or you're on other drugs which are what we call immunosuppressant or steroids, you must come forward and take the vaccine. It's safe for you.
All right. And can heart patients on blood thinners get the vaccine? There have been certain, advisories that have been issued against blood thinners. Could you clarify?
So I think we need to understand what do we mean by blood thinners. When we're looking at drugs, what the heart patients are taking, they're taking drugs which are known as antiplatelet drugs. These are drugs like aspirin, ecosprin, or clopidogrel, which are given to as antiplatelets. These are not contraindicated, and if you're on such drugs, you can still go ahead and take the vaccine. There is no contraindication. If you're on drugs which you call anticoagulants, which decrease clotting, and these are drugs like heparin or drugs like warfarin or other drugs like abeximan and dabigatran, these drugs can lead to a little bit of blood collection or hematoma formation at the site of injection.
Right.
So you should consult your doctors. Sometimes you can stop these drugs for 2-3 days and then take the vaccine and then restart it, so that at the site of the injection there is no collection of blood, because these are blood thinner, anticoagulants.
That's an important clarification there. What about, if you're unwell and you are undergoing medication for a common disease, should you stop certain medications before getting the vaccine, or should you make a full recovery and then get the vaccine? What do you recommend?
So if you're unwell, say you have a cold or cough or you have fever, one would wait till you recover and then take the vaccine. It's not that you have to take it immediately. So it's better if you have a short illness that you recover. But if you have a chronic illness, like someone has chronic bronchitis or he has heart disease which is requiring treatment for a long period of time, or he is, let's say, a post-transplant patient who's on drugs, or a patient who's on regular dialysis, then you should continue with your treatment and come forward and take the vaccine.
Right. What's the ideal time gap between any other vaccine and the COVID-19 vaccine? So if you've received any other routine shot, or you've had an anti-tetanus or any other vaccine, how much time gap should there be before you get the COVID-19 vaccine?
So a lot of people are taking vaccines for example, for the flu shots, the influenza vaccine or the pneumococcal vaccine for pneumonia.
Yes.
One would really ask them to wait for around 2 to 4 weeks before you take the vaccine, although there's no clear-cut guidelines as to how long you should wait. One can wait for about 2 weeks before taking the next vaccine.
All right, on the safer side. What about insulin injections? Can the vaccine be taken with those who are regularly taking insulin injections?
Yes, definitely. There is no contraindication. You can take the vaccine, and you should take your insulin injection also as you regularly do along with the vaccine.
So you can take your insulin injection, say, twice a day and still get the COVID vaccine on the same day?
Correct, correct.
All right. Is the second dose of the vaccine necessary for even those who, say, developed an adverse reaction after the first dose? So if someone developed a fever or had a side effect, should they still go ahead with the second shot?
Yes, they should go ahead with the second shot. The only thing is, if you develop a severe allergic reaction, like I was mentioning, one of the rare side effects like anaphylaxis, then you should not take the second shot because you had a severe allergic reaction to the vaccine. But if after the first shot you had fever, body aches, or a little bit of headache, that is not a contraindication for taking the second shot. You should go ahead and take the second shot because that will give you better and more long-lasting immunity.
Right. Dr. Guleria, one of the other, points of confusion is how do you gauge whether your reaction to the vaccine has been severe or not? In that half an hour of a waiting period, would the healthcare professionals advise you?
So when you have a reaction, you will definitely come to know. A lot of people will have palpitations, some have a little bit of sweating, there's some do develop a skin rash, and there is fall or change in your blood pressure, and your heart rate also goes up. So this is monitored at all the vaccination sites, that if you have any symptoms or any complaints, your blood pressure, your pulse and oxygen is checked, and you are taken to the site which is designated for monitoring or severe side effects, and
So
treatment is initiated
you
there.
will, in a certain sense, receive the advice that you need. Should patients who've had severe COVID-19 illness get vaccinated?
Yes, the patients who've had severe COVID-19 illness should also get vaccinated, because we know that over a period of time your immunity will come down, and the vaccine will actually help to boost the response, and that way it will give you better immunity as far as the vaccine is concerned. Especially those who've had vaccine, who's had the illness many months ago, 6, 7 or 8 months ago.
But if you've recently recovered, what's the optimum time gap?
So if you're recently recovered, one would say that at least wait for about 4 to 6 weeks and then you can consider getting yourself vaccinated.
Can
There's
you be...
also an interest.
Sorry, please go ahead.
So there's also an issue of should you take only one dose or should you take two doses if you've had COVID infection in the past. But that is something which we are still looking at, but I would still advise that you should take both the doses.
All right. And can you be reinfected with COVID-19 even after vaccination? What are the protocols that you should follow after you've received the jab?
So once you receive the jab, we must understand that it can prevent you from getting serious or severe illness. That is, you will not need to be hospitalized. You will not really have to go to the ICU. It will decrease mortality. But some individuals can get reinfection which may be a very mild form of illness, or they may have a very little, or they may be asymptomatic as far as the illness is concerned. But the virus may replicate in their nose and throat, and they may be infectious for a few days. Therefore, even after getting the vaccine, you have to have COVID appropriate behavior. Wearing a mask and physical distancing is still important till everyone gets vaccinated, because people in your surrounding area or your family may not be vaccinated, and you could give them the infection, although you yourself would be protected.
All right. So you could be protected, but you could still get infected and pass on the infection. So you absolutely cannot afford to let your guard down. I think that's a great message to end the broadcast on. Thanks so much, Dr. Guleria, for sparing your time and being with us on NDTV.
Thank you very much. Thank you.